So let's get stuck in. And it's great to have such a diversity of different viewpoints within the healthcare ecosystem here. I'm going to start, I think, with you, Anka. I think this is all about patients and citizens, so I think it makes sense to start with you. What are you hearing from your constituents, the people you represent across Europe, in terms of what is needed for healthcare sustainability and resilience?
Thank you, and thank you for the invitation. Good morning.
Good morning.
I'm very pleased to be here, and I'm also pleased that I'm not the only patient representative throughout this conference, and that is precisely what my constituency, patient organizations from all over Europe, expects in building sustainable healthcare systems, health and healthcare systems. We need systems that deliver for people. They have to deliver health in a outcomes-driven manner, in a needs-driven manner, in an environmentally friendly manner, in an innovative manner. All of these are part of sustainability, and it's really, really important to us that this whole process of rethinking starts from the fundamental needs of those that health systems serve, which is, well, us citizens, all of us, really.
Mm-hmm. And what are the broad principles that underpin delivery on that, would you say?
Dialogue, inclusion, inclusivity, pulling in the civil society, the organizations, but also the people. And this dialogue has to happen at every single level of the health system. A health system that doesn't prevent is unsustainable. A health system that is not able to treat is unsustainable. A health system that doesn't look after its professionals is unsustainable. A health system that does not enable and allow new ideas, new solutions is unsustainable. And a health system that hurts the planet is also unsustainable. And it's a tall order. It's a tall order.
Exactly the word that was in my mind.
It's a really tall order. Yeah. But health systems are fundamental to the future of humanity and to the future of the planet. There's no other way around it.
Okay. All right, that's
high expectations. But all of us have to work together, and the patient community and the health and the public health community have grown into a significant ability to be part of this dialogue and to contribute ideas. And so having us here and having us there in the future, in the room, in the sandbox, we were talking about it in a different meeting yesterday. It's really crucial, because if you don't deliver for people, then why are we here?
Yep. Okay. Well, you've set out, and I know that the European Patient Forum is doing specific things to sort of progress that agenda. But I think you've set out a very ambitious. I think that we can all agree with, or we get a round of applause there, we agree with. So let's now turn to the other panelists. Glyn, Bupa, as an insurer and a provider of health services, your group sustainability director. So what are the agenda's been set here?
Yeah.
Can you tell us how you're approaching that kind of tall order?
Yeah, I mean, and thank you, Anka, but I think great sort of summary on kind of the challenges we face, and very, very consistent with what we're thinking about as an organisation. So very briefly, if you don't know Bupa, we're an international healthcare company. We do health insurance, healthcare provision through hospitals, clinics, dental. We also do aged care provision in a lot of our markets. We serve about 43 million customers, 82,000 staff. So we're a fairly sizable healthcare player. But what also is interesting about Bupa is, first of all, the diversity of services that we offer, and also, frankly, the diversity of operations. So we have a very good sort of sense of what is happening across the world. I think pretty much the States is pretty much the only place we don't have a delivery of healthcare in country. So I think for us, what we see is, and similar to the themes that Anka's already called out, there is no net zero future without healthcare. And so healthcare has to be part of that net zero future. At the same time, we know that healthcare is 5% of global greenhouse gas emissions. So there's this kind of crazy situation where we have an industry that's designed to look after people and improve their health, which is actually contributing to problems which we know are harming human health. And so we have this sort of, where we went back to the basics on our sustainability ambitions and said, well, actually, where is this sweet spot for us? And I think that was this intersection between human health and the health of the planet. Mm-hmm. How do we deliver on both of those? How do we make sure that we are looking after our customer outcomes and patient outcomes, because that is incredibly important, as we all know, but at the same time, doing that in a way that is environmentally conscious, socially conscious, and I think that's exactly where we're trying to sort of focus at the moment. So one of the things that Anka's called out already is it's an exciting space for us is this role of preventative medicine. And I think for us, we have a long 76-year history of delivering healthcare, and that now obviously covers hospitals, clinics, physio, dental, but at the same time now what we're really starting to think about is how do we really lean into that space of prevention, because that is fundamentally the best way of treating people, is just not have to do it in the first place. So, and it also happens to be the most environmentally conscious way of doing that. Now that shows up in different ways, and we can talk about that in a little bit more detail in a second, but I think that's really where we're trying to focus, is how do we shift our operations to become less impactful on the environment, so cutting greenhouse gas emissions, championing circularity, changing our products and services. But also, what is our role as an international healthcare company in shaping that broader healthcare system? And that you actually have to look beyond the healthcare system to do that. And that's what's incredibly exciting about some of the things we're doing at the moment. The third piece of our strategy really focuses on recognizing that doing less harm is only part of the solution. You need to do more good. You need to become a regenerative business. You need to address the things that are actually driving people's health. And for us, that is the environments in which they live, it's the behaviors that they exhibit, so whether they exercise or eat healthily or all that kind of stuff. And at the same time also, what are the key ecosystems that drive human health? Whether it's the oceans, whether it's the forests, what is our role in looking after those? Because we see that role of looking after people's health, living our purpose of longer, healthier, happier lives and making a better world. We view that very holistically. And that's exactly where we're trying to focus our sustainability efforts.
Brilliant. Thank you. I mean, so you've set out some core principles, and I'm going to push you in a minute after we've heard from everyone else on kind of specific examples of how that's manifest. I think maybe I'd like to hear actually from Martin, because in the notes that we've kind of discussed before this session, I was really interested in how you talked about both environmental sustainability and financial sustainability, and how the two actually are aligned, because often they might be seen to be in conflict, and in healthcare they are very much aligned. So perhaps you could address that.
Yeah, sure. Good morning, everybody. Look, I think a healthy planet and a healthy population go hand in hand together. So you need to look at sustainability through a number of different lenses. And in Johnson & Johnson, for example, we're looking at how we can decarbonize our operations. We're going to have 100% of our operations from renewable electricity sources by 2025. That's very important. But perhaps coming back to something Anka was talking about, one of the things that we need to do is to look at sustainability broadly. At its heart, sustainability is about maintaining or improving favorable conditions over the long term. So it's about continuous improvement, and it's about a long-term vision. And particularly one area we're interested in is healthcare system sustainability. So how can we organize care to drive and improve patient outcomes whilst minimizing variation, which is a huge issue, and reducing wastage? So we talk a lot about affordability of healthcare, but a lot of reports will tell you up to about a quarter of resources are actually wasted. Yeah. That's the least sustainable thing you can do. So we need to tackle wastage, and we need to focus on patient outcomes. And I think there's a couple of areas. First of all, innovation, incredibly important to drive sustainability into the future. How can we adopt new technologies, new ways of thinking, both therapeutics but also digital technology? And how can we shape the care pathway to improve outcomes that matter most to patients? Because if we have that focus, I think this is key for sustainability in the future. Part of the problem, of course, as well as affordability, is the fact that I think anybody in this room who works for an organization has their objectives set for the next 12 months, and if you're responsible for a budget, your performance managed on keeping within that budget for the next 12 months. The challenge is sustainability requires long-term thinking. Maybe you need to do things differently, think about value-based healthcare, organize the care differently. But how do we break down those silos to enable us to do it? So, the question often asked is, can we afford it? And perhaps the real question is, can we afford not to do this?
Absolutely. Robert, let me ask you then, because again, we have a number of levers that we can pull to kind of enable what you're talking about, which is a long-term vision, getting everyone aligned, and overcoming some of these structural barriers around budgets and so on. And I think large companies, governments have a role, obviously. Large companies also have a role and have a lot of influence, and that's something that I think you've discussed with me again before the session. So perhaps you could address some of that and what those levers might be for larger companies.
Yeah, happy to do so. Thanks, Vivek. First of all, let me also say it's really great to see how people are coming together and how the topic of environmental and people's health are being discussed together. And I think, Philips, of course, is a household brand, but I think in this audience, I don't have to explain that we are one of the leading health technology providers in the world as well, which puts us squarely in the discussion. And the points that you made earlier, right? So by any standard, Anka, that you mentioned, you can say the healthcare systems are not sustainable today. They are not accessible, they are not equitable, and you mentioned the 5%, but 5% is due to the fact that half of mankind does not have access to healthcare. That's 4 billion people, right? In countries like the UK, where people do have access to healthcare, it is closer to the 10% mark. Actually, already right now, on a global average, healthcare systems are emitting more CO2 than airlines and shipping lines together. So last week I spoke with the gentleman who transplanted the first ever heart in Portugal. He's retired by now. He's a very charming, wise eminency, you could say, in the healthcare sector. And he is dedicating his time to really understand how to mobilize healthcare providers, physicians, train young generations to create that awareness. They have started to quantify that the effect of pollution that the Portuguese healthcare system is creating is causing as many dead people per year as the first entire COVID wave in Portugal. So that are signals that are coming from the healthcare sector, so I fully agree what has been said. Now, to your point, long-term vision, we also need long-term financing, and we need a governance structure that allows us to see that through.
Yes.
So we need to not just have some great vision and perspectives like net zero in whatever, but we need to break it down. So for instance, we adopted science-based targets at Philips for scope 1, 2, and 3, which means basically for those of you that are not in that ESG sustainability lingo, science-based targets means to reduce your carbon emissions to an amount that is not contributing to global warming beyond 1.5 degrees. Scope 1, 2, and 3 means scope 1 and 2 is your own operations and the electricity that you source. So we source 100% green electricity globally, which is great given the current energy prices. I think you will talk about that, Simon, later on. But scope 3 is a factor of 80 bigger than anything that you have in your own house. It includes your suppliers. We have 15,000 suppliers, and it includes your downstream. What happens to the imaging equipment that we provide to care providers globally? So we've really made a very much an effort over the last 2-3 years to translate these science-based targets into innovation roadmaps so that every product developer, engineer in Philips knows exactly what are the energy efficiency requirements for the next generation of MR scanners, CT scanners, ultrasound machines that will go into the market in the next years. And I think that's a precondition to also talk about health equity, right? Keeping stuff affordable and not killing the planet while we try to save patients. Let me stop here, but I think that consistency between the long-term vision and what we do today, empowering people to take short-term action, is really important.
Okay. So really you've described the role of technological innovation in any company involved in healthcare in the interest of efficiency and sustainability, supply chain management, including energy supply, which is a major issue. So then let me pick up on that with Simon. Simon, healthcare facilities, hospitals are great polluters. Very intensive activity goes on, not just with carbon, but I guess there's radioisotopes, all sorts of things that go on within a So what, as a facilities management perspective, across a broad range of hospitals and healthcare facilities, what can be done, or what are you doing?
Well, first of all, thank you for having me. And I've been the last one in the line of great and smart speakers, so I try to add things that haven't been said so far. And Charité Hospital, we are one of the biggest hospitals, university hospitals in Europe. We have about 22,000 employees, and we're kind of our own city in a city. And that means that we pollute a lot, you said that, and everything you try to achieve has a big impact on the city, on the environment, on your patients, on your workforce. And I think, first of all, it is important to break down your global goals, your general goals, into bite-sized pieces. People, in my understanding, are sometimes overwhelmed with the news of climate change, and it's a horror scenario. And you're right. Charité and the whole healthcare system, we're polluting an enormous amount of CO2 emissions. But how do we reduce that? We need to boil it down to really concrete actions. We need to build networks. We need to make people aware of what they can do in their daily lives. And one example is, last year, we've all experienced a major energy crisis. We tried to reduce our heating. And how do you do this? How do you convince your people to heat your offices with 19 degrees? Well, we built these little thermometers and put them in every single desk. 22,000 desks we provided, and people are aware of their general of their concrete actions. Turn off the light, turn off the heating on Friday night. It's very simple, but when it comes down to a big organization, it multiplies. Mm-hmm. So I think we need to be concrete. We need to be concrete as an organization of what we do, and we need to make it easy for people to participate. One thing I would like to add. The second is sustainability has become a hard economic factor. And yes, Martin, you're right. It needs to have a long-term financing perspective. But this gap of when you have your return on invest is getting smaller each year. At Charité, we had energy costs last year of 35 million euros. Next year, we're planning on 90 million. That means every light bulb I exchange to an LED light is saving me, in the long run, a lot of money. Yet again, we have 240,000 lights at Charité. We're working in a million square meters. It's a huge organization, but we can sit here and say, okay, it's huge and it's hard to tackle, or we start. And the last thing is, we've experienced that it's an essential factor of why people join our workforce. The health system has a problem in finding good people that are willing to work in. I think that's a general situation in all of your countries. Yet, if people that privately think sustainability is an important thing see that their employer takes action, it's a difference, and people can choose where they work. And so we've polled our new employees and sustainability, and the sustainability action that Charité has taken place in was a major factor of why they decided to work with us. So I think these are the three things that sustainability is not just good for the climate and for our future, it's good for our business too.
Mm-hmm. Thank you.
Well, that's really good. So I think we've all of you have set out ambitious visions and actually some key pillars of what your different organisations are doing. I think, and you've also raised actually that we can come back to maybe a bit later, issues around the role of market incentives and shaping the market to actually adapt to it. And that obviously brings into play things like the role of government and partnership with other institutions, which we can come back to. But I want to give each of you now the opportunity really to, as I said before, some specific examples of how the principles you've articulated are actually manifest within your organisation. So maybe Anke, you could start, and I'll just go in turn.
Sure, thank you. One of the examples that we discussed in our preparation was our work. So the European Patients Forum works as part of many different types of stakeholder partnerships. And what we've learned is that public, private, plus academia, plus patient organizations, plus expertise, plus regulators, plus partnership. It's a model that can deliver quite a lot. It can deliver innovation, it can deliver regulation, which is necessary. It can deliver transparency and accountability. And I mean, I know you guys, you're often accountable to shareholders. Citizens are shareholders. Governments are accountable to their citizens, right? And here we are. I'll give you an example. In our, we're part of a 30-plus partner from all of these area consortium that was started in 2020 with European research funding to learn from the pandemic. It's called Periscope, and it's got a very long name, but the idea is what lessons can we draw from the weaknesses revealed from the COVID pandemic and from the barriers that patients encountered as a result of that pressure on the health system in order to inform rebuilding resilience and rebuilding the systems and drawing some governance is so important, lessons for the health systems in the future. What can we learn that we can prevent in the future? And this is looking at a tiny bit of the system, but it's a really important part, which is the people's access to care, chronic patients' access to services and to care, and how that was affected during the pandemic. We ran 2 questionnaires, and we've learned so much from our members and from individual patient organizations with their aggregated view, but also individual patients about what the hardship was, the delays. I mean, all of you know this, but we're going to be able to quantify these and draw some policy recommendations. Watch this space, it's coming next year.
Great.
So,
Glyn, your turn.
So I think in terms of specific examples, why don't I try and do this through the lens of sustainable healthcare. So looking at prevention, I think one of the things we're really looking at is this behavior change piece. How are we thinking about sort of encouraging our customers, there are 43 million of them, to change their behaviors so that they don't need to access healthcare as sort of intensely or at all as they currently do. And one of the kind of flagship programs we have in that space is something called Healthy Cities, which is started as an internal engagement program, really, but it was really around sort of you get up, move, change your behavior, leave the car at home, walk to work, whatever it happens to be. But the idea was we would then link that to a regeneration benefit. That was the kind of the carrot at the end of the stick, if you like. So, and what we found is that really resonates with customers. They love it. It's a kind of, it dials into well-being, it dials into kind of general kind of activity. It's a nice way of getting people together. And actually, it's almost become, whilst it is a sustainability initiative, it's not really badged that way. It's not really embraced that way. And I think it's been great in terms of driving behavior. And what we've taken, that program started at Spanish Business about 8 years ago, and we've taken that global now. And it has been great. I mean, it's also been fantastic just seeing the level of competition between our respective businesses. But I think what's really exciting about that is how we then pair that behavior change, because that is a very versatile product. You can take that and say, it's not just about steps, it's about diets, or it's about mindfulness, or whatever it happens to be. I think there's an opportunity to pair that with a digital customer offering, which dials into the sustainable pathways element, so the second part of our sustainable healthcare piece, which is something called Bluer. And Bluer is a digital program which we essentially allow customers to engage with their healthcare providers over a video conferencing suite. They get all their reports delivered digitally. It's all inside an app, and we're building more and more capabilities into that. The thing we've done with that is also paired a carbon calculator. So we worked with the Carbon Trust to identify a carbon calculator for those activities, so you could actually tell your customers what carbon impact they have had by taking a virtual consultation or by having their results or products delivered to them virtually. And what we found is also it is incredibly convenient for customers. So it's been incredibly useful in terms of driving up access to those services, because it's helped our customers access those services when they don't need to now drive or get on a train or whatever it happens to be to go to their local GP or doctor. They can now access that from the comfort of home or work or wherever it happens to be. And we found that the repeat usage of Bluer to access those services has gone up. And the moment you use it once, you're much more likely to use it again and again and again. And that is great because it's actually allowing us to create more capacity, if you like. Over the long term, it'll create more capacity in our healthcare delivery units. So, people are now accessing virtually, so you don't have people sitting in a waiting room. You can have more people accessing the same facility. Sustainable practice, like Philips, we've set ourselves sustainable. We have science-based targets. So we have a target to reduce our Scope 1 and 2 emissions by 46% by 2030, in line with the 1.5 degree alignment. We're just shy of 40%, and we had that as an interim target for 2025. And frankly, that's been a huge investment. There's a lot of work. But what we've also taken is our renewable energy percentage from about 54% in 2019 to over 87% at half year this year. So, there's a lot of opportunity with relative ease, I would say. Now, the real challenge we have is how we tackle our Scope 1 emissions, the emissions we create. So that's the air conditioning, refrigerants, that's also anesthetic gases. We have a lot of them. We're a healthcare provider, and they are very potent greenhouse gases.
Right.
And that's where things like innovation programs have been hugely beneficial. We've worked with startups through a sort of what is designed as a talent and innovation program with a sustainability bent. We've worked with a company to identify a circular solution for exhaled anesthetic gases. 95% of anesthetic gases that are inhaled are exhaled.
Right.
And then they are vented to the environment. These are hugely potent greenhouse gas emissions. And so we capture those with a partner, and we clean them and recycle them. And guess what? It has the potential to reduce cost in our supply chain too, because we're no longer having to buy all of those huge volumes of anesthetic gases. So we're in the process at the moment of trialing that with a hope that we can scale it across our operations. And then I think that touches on the fourth piece, which is collaboration. And it's come up so often on this panel already. Collaboration across the sector, and we are in a number of coalitions that help us do that. So the Climate and Health Coalition with other healthcare companies. We are also part of the Sustainable Healthcare Coalition. We're working really closely with other healthcare-focused collaborators, but we also work with Healthcare Without Harm and the UN Race to Zero. And we recognize that we've also created some bilateral collaborations, recognizing that this role of preventative medicine and the sort of behavior change is something that we have to do, which goes beyond just healthcare. So there's a couple of those which are in the offing as well.
Fantastic. Really good examples. And I like, again, the emphasis here that the right thing to do is quite often the commercially sensible thing to do too. Right, that's great. Okay, Robert.
Yeah, I think it's a combination indeed. Thanks, Glenn. So we have been on this journey for a long time. It's probably about time to write a book about it. But I will not give you 300 different examples, but maybe just a couple of things. So we started really in the end of the 1990s with eco-designing. So showing that you can actually create healthcare equipment with a significantly lower environmental footprint. Then in the early 2000s, we started to really mainstream that. Actually, I joined the company 15 years ago. It was part of my first programs. So we had an R&D budget of €1 billion for the first wave of that, and 2 billion for a second wave to really mainstream eco-design. And it's now a mandatory practice, which means that we have 25 years of experience on how to do that. And that is exciting, as that provides a really critical asset to go and engage with care providers. Now that is on everybody's radar screen. but also internally. I mean, it's such a huge factor. You spoke about engaging your employees. So every year we run an innovation challenge to continue to drive energy efficiency. In the last years, we have reduced the operational carbon emissions with, I think, more than 78% or so. We operate carbon neutral since 2020 on a global level. We have our own wind farms. That is exciting because we know how to do stuff. Now, with that knowledge and these capabilities, we can go to our suppliers. I said 15,000 bill of materials suppliers. We can teach them, we can share them, we can incentivize them. We have linked, for instance, working capital financing to achieving sustainability targets. So we really build these kind of masterclasses, academies, what have you not. It's good for them, it's good for us. It reduces the bill of materials, it takes emissions out of supply chain. 3 years back, we said, wouldn't it be great to have 50% of our supply chain to also commit to science-based targets? And that sounded insane at the time. Now it's 42% of our suppliers have committed to do that. So we also will have the lowest carbon emission supply chain in the entire industry. And the really interesting thing happens when you bring it and team up with the leading care providers around the world. Like, it's so exciting to hear these examples. So we are running right now a series of studies, basically in all continents, with leading care providers where we really try to understand what happens on the ground. So it's not just about energy efficient equipment from Philips or anybody else, it's about how you use it. You spoke about behavioral elements also, switching it off, using energy standby mode. How do clinicians look at the effect of these kind of things? That's one thing. The second thing is circularity. So taking back these large scale, if you think about the huge amounts of energy that go into getting all the materials out of the ground to build an MR scanner or a CT scanner, if you can reuse the magnet is a magnet basically, by and large. But there's so much happening around it. I mean, throwing away your telephone because there's a better camera on the market, that's not what we want, right? So really modularizing these things, being able to maintain it, expand the life cycle, provide over-the-air AI, whatever kind of updates to get better imaging quality, that's a huge thing. And I think the most exciting horizon, to Martin's point also, is really working together with care providers to think about optimizing care pathways, thinking about prevention, where clinical outcomes, environmental outcomes go hand in hand. I think that is the future. So we really want to make healthcare systems sustainable, then these things need to go hand in hand. Let me stop there for sake of time.
Thank you. Yes. So I want to get, yes, let's keep moving on. You've already given a couple of examples, but maybe you want to expand upon.
Yeah, I think it's really motivating what Robert just said, because we analyzed our supply chain, scope 1, 2, and 3. And a lot of companies, a lot of hospitals, a lot of providers say we're CO2 neutral because they buy eco-friendly energy, electricity. We do that too, but yet again, we know that 80% of our CO2 emissions are is not in our direct environment. It's along the supply chain. And then we need to team up with partners like Philips. And to give you a very concrete example, it is very important to bring transparency into this. We just found out that 10%, it's crazy, 10% of our CO2 emissions along the supply chain are based on the fact that we buy plastic gloves. The plastic gloves that doctors need are producing 10% of our CO2 emissions. And when you know that more than 60% six times less CO2 emissions are used if you just disinfect your hands, you need to work with your people to use less gloves. I'm not talking about operation theaters, I'm not talking about infectious diseases or anything, right? But, I mean, the amount of plastic gloves we use is insane. And so, cutting this down would cut a significant amount of CO2 emissions. And that's just a very concrete example where you could start today, right? In other examples, you need your providers, and you need providers that are on the same track as Philips, for example. That's one thing. Transparency and concrete actions. we need to provide mobility solutions for our workforce, right? We're in the city center of Berlin, and we already know that only 20% of our people use their cars. And you can engage them in using bikes and public transportation, but if you don't provide safe bike locks and places where they put their bikes, they won't take their bikes. So it's very concrete, very simple, but that really makes a difference. And it goes on in your how do you remodel your buildings. It's a huge factor, and it's a huge factor that we need to work on. We're state funded, and the funds are not flowing in like we would like to. But renovating your buildings, your roofs, and your windows, that makes a huge difference. And then again, food. We cook about 5,000 lunches each day for our patients and our workforce. And the fact that you need to reduce food waste and maybe cut down on one meat dish a week. These are the simple examples I'm talking about, and I think that provides an atmosphere in a company that people are more aware of it. A lot of people like that and say, "Oh, Charité is really saving the planet and is a sustainable company. This is the place I want to work at." And I think that's the goal, to kind of nail it down to concrete things.
Well, the rest of the time is yours, I think, Glenn. If there's time for questions, we'll take them. But I think it's really important to have these concrete examples. So the rest of the time is yours if you want it.
Okay, thank you. Yeah, look at three areas probably that we're looking at. First of all, I talked about innovation. I think scientific discovery, innovation, research and development is incredibly important. Why? Because, particularly if I look at the portfolio of research and development in our organization as well as other big organizations, there's very much now a focus towards interception, cure, or functional cure. So just one example, cell and gene therapies. Can we actually intervene once with one administration and change the course of a lifetime disease? Incredibly sustainable. There's an issue because there's an upfront cost and there's an accrual of benefit possibly over a lifetime, but incredibly sustainable to be able to cure and intercept. If I look at oncology as well, it's very much going towards that interception or functional cure. And I think we're making incredible strides. The issue, of course, is access. And the issue is, how can we get these treatments to patients as quickly as possible? Because when we're talking about oncology, for example, time is life. But in Europe, if you listen to the FPA weight indicator, which measures this, there's only 45% of innovative medicines available to patients, and on average, they're having to wait 1.5 years, and this is time that people don't have. So how can we foster innovation, get it quicker to patients, because it will change the course of diseases? So that's one. Second area is about partnership and collaboration, and we've talked a lot about that. But just a couple of examples. We're partnering with a number of big hospital organizations in Europe, and we're working with them to say, can we reorganize the care and delivery of certain diseases so that we reduce things such as patient travel, time to infusion clinics? Can we deliver care closer to home? But fundamentally, can we improve outcomes? Because if you improve outcomes, then to a degree, the rest will follow. So that's partnership and collaboration across sectors, organizations like ourselves, incredibly important. And the third thing is data, which is something we haven't really talked about. But I think in terms of driving sustainability, having data, making evidence-based decisions is really, really important. So something we're trying to do is federate data, connect it across multiple organizations so that we can really harness it, because the problem is often it's in different formats, different sources, but can we federate it and leverage the power of data to make informed decisions, track progress, and course correct?
Really good. Yeah. Okay. We probably have a yes. Yes. Go ahead. Yeah. And please tell us who you are. There's a mic just coming to you now. We probably only have time for this one question, to be honest.
Yeah,
but
I'm a surgeon, so I work on the ground. And so 50 to 70% of hospital waste is in the operating theatre. It is impossible. Everything is disposable. Even if we've tried to say, well, some things could be reused, and we're told that up from the top, we're not allowed to, even if it would be safe. The equipment that's used, say for swabs, you have a huge plastic sheet in which you stick things just to count the swabs. You also talked about the gentleman from Charité about antiseptics. There's a real problem with antiseptics at the moment, and I'm looking into it for our association. We can't get the antiseptics that we want. And they're being replaced by antiseptics in small little packs that are full of plastic. So instead of a big bottle that would be suitable for 1 or 2 cases, we're being forced to use, and it just breaks your heart. In the last 20 years, you will not do a small operation without at least 4 big bags full of waste.
Okay, so is that a comment or is just a question? I can take it as a comment because I think there are obviously things that people are seeing in their day-to-day practice that are not then getting. I mean, this is the general point you're making. I think is that we, if you just ask people, they see it, and there may be ways of adapting it. And we can take it as a comment, but we're out of time. So really quick, any quick words to say about that?
I think that's an example, a perfect example. And waste reduction and circular economy is a huge challenge in a huge hospital. We need to think ahead of. We need to think of ways to separate the trash and to really recycle and work with recycling companies. But that's something we're facing. It's a big issue.
Maybe I just want to say it's so encouraging to see that people are teaming up. So there is Healthcare Without Harm. There are organizations of practitioners. So you don't have to fight this in your own and reinvent the wheel. So I'm sure that you are connected also across the field. But that's good to exchange these practices. Yeah.
Great. Okay, well, we're out of time, and thank you very much, and thank you for that comment. I think it's really important to listen to people who are actually at the front line. Okay, great. Thank you very much. That's foreshadowed a lot of the discussions we're going to have over the course of the next 2 days, and it gives me hope, actually, that we're actually being taken seriously and we're actually making inroads with specific examples there. Thank you very much. That's great.